So welcome back, everyone. I am so excited about bringing on my next guest. And what I want to say too is that we're live on Facebook, so hello to everybody out there. Like us and follow us. I have with me Crystal Alston. She's the owner of HealthPointe. Welcome back to the show. You came on a little bit shorter. Now we're going to go a little bit longer. I want you to tell everybody first a little bit about yourself and what you do.
Okay, absolutely. Thank you so much for having me on. I really appreciate it. It's so nice to be back. All right, my name is Crystal Alston. I am a family nurse practitioner. This is held up by my registered nursing degree, which I so proudly have. I am originally from Buffalo, New York, where I received my my latter degree. I live here now in Phoenix, Arizona. I live in Goodyear. That's where the company is kind of born, where I pretty much own HealthPointe. This is a telehealth medicine-based company. We are all about access to healthcare is the big thing. I have been a nurse for over just about 18 years.
Wow.
This is coming up pretty soon on 19 here.
Wow.
But I've been a family nurse practitioner for the last 5 years. And that is me.
So I want to talk a little bit about the fact that you have a plethora of different health arenas that you help people with. So that I would like to talk about that first, because healthcare, we're talking about people who also may not even be able to be mobile, because you're both telehealth, but you're also mobile. You'll go to them, and I want you to talk a little bit about that as well.
Yes, absolutely. So because we are such advocates of access to healthcare, just making sure that it's available to those who need it, we also provide mobile visits. We do home visits. So if you are, a little challenged as far as having a vehicle or mobility is challenged, HealthPointe, we are willing to come to you.
That's pretty awesome. Now, I know that you're very excited about, number one, the fact that you do take most insurances, but that you just also are now taking Medicare.
Yes, we finally got Medicare. That contract was a little bit hard to attain, but with my amazing credentialing team, my billing team, we were able to nail down a Medicare contract, so we are open to take Medicare patients. Absolutely.
So let's talk about some of the services that you offer.
Sure.
and the different areas. I mean, let me tell you something, folks. I can tell you about what I've learned about you. You are a very busy lady.
Yeah. Yes,
but
indeed.
helping people in the health arena. And you do expos. We're going to talk about what is coming up that you're doing. You are definitely out there, and that's what you're all about. But helping people with health issues.
Correct. That is kind of our forte. It's, my degree is foundational primary care, so I can see anybody through the lifespan. We see any patients. I typically see patients 30 days or older. No neonates, no brand new babies fresh out, but anybody who's older than 30 days old until death. That's what's kind of special about my foundational degree, is it offers me the opportunity to see a wide array of patients based on primary and chronic health ailments that we treat, and this includes chronic Medicare medication management, primary care physicals, preventative health screenings, aesthetic medicine like Botox and dermal fillers. We also do hormone replacement therapy, GLP-1s for weight loss management, things like that.
So that's quite a bit.
That is
now, when you contact them, then you can call her at 623-286-1674. Her website, it is HealthPointe, POINTEAZ.com.
Correct.
The other thing that I wanted to also point out too, which is something that I had never heard about, I just learned about it today, ZocDoc. You can also go there, and I want you to tell them, because not only can you learn about it, you can look her up, but you can also make an appointment from there as well.
Absolutely. So we recently got hooked up with ZocDoc for HealthPointe. ZocDoc is a super amazing platform where you can kind of learn a little bit about the healthcare provider that you're going to be seeing before you book and see them. Oftentimes, patients want to feel in control of their healthcare. They want to be able to take part in the decision making. They kind of want to pre-screen the individual. Nothing wrong with that. If you book through a ZocDoc, you're able to read a little bit about a bio. You can read about where they went to school, where they did their training, what they specialize in, the age ranges that they see, and even insurances that are accepted. HealthPointe accepts most insurances, and you're able to book an appointment right on ZocDoc.
So, but HealthPointe, and health care is your biggest priority.
Correct.
Right? And taking care of yourself. I'm going to say this. There's a lot of people right now that, I don't know why, but they just don't take care of themselves all the time, right? And you're there to help them not only through telemedicine, which is so nice. It makes it so easy, but also if you are immobile or if you have challenges in that way, they come to you. The number again to call is 623-286-1674. Check her out on her website, which is HealthPointe, POINTEAZ.com. You also have coming up, this is going to be really fun, in Scottsdale, the Scottsdale Hilton Resort. You want to talk about that health expo that's going on?
Yes, we do the Health and Wellness Expo. They have varied trade shows throughout the valley. They have them in the East Valley, West Valley. We've been to a couple so far as a company. Upcoming, we got the Scottsdale Hilton Resort. We're going to be doing the Health and Beauty Expo on Halloween. One of my favorite holidays is just, you can be anybody, do anything. So one of my favorite holidays, I thought might be fun to spend healthcare in there. We will be amongst other vendors, health vendors, offering health services.
And that's going to be happening on October 31st. You can check that out. Is that going to information on your website?
Yes, we usually post it about a couple months before we get started with the Health Expo. We'll be there from 10 a.m. to 3 p.m.
That's really cool that you're involved with all of these different things. I want to go back to you. I'm going to go take it down. We have a lot of people that are listening right now that we're talking about. Weight loss is huge,
yes,
especially the GLPs. I want you to talk a little bit about them because some people, they're either on the fence with it, they're either all into it. What are your thoughts about them?
GLP-1s can be a great way to initiate weight loss to help you on your journey. Now, I do believe that there should be more like a patient screening. You want to make sure that we're choosing the right GLP-1 for the right patient. It's important to make sure that you evaluate other conditions, other medications that may contraindicate, and to be sure you give the patient a true depiction of what this looks like as far as adverse effects, side effects of the medications, ways that it may impact their lifestyle and their day-to-day. It sounds great, weight loss is great. It should never be quick and easy. Weight loss it's important to go low and slow. It's important to balance homeostasis and make sure that you are doing it in a time and frame that's good for your body.
And having somebody who, like you, who can, walk them through it.
Correct.
You can't just do these things on your own. It's to have somebody that can help you make sure that you understand what you are doing.
Correct. I always say, for every pill, there's a price. Pharmaceuticals they can be great. There's a time and a place for pharmaceuticals to help out with some of the, the health issues. Obesity is a disease and we should treat it as such. It deserves treatment. The important part is just making sure that we balance that with lifestyle modification and pharmaceuticals accordingly.
Her phone number is 623-286-1674. She's rated with the Better Business Bureau. Check her out on her website, which is HealthPointe, POINTEAZ.com. Telemedicine makes it wonderful, makes it very easy.
Yes.
When you first are working with somebody, do you like to have that telemedicine conversation where you get to know them? How does it work?
Yeah, we essentially want to talk about history and just, who you are, what you're looking for. It kind of depends on, of course, what they book for. If it's a sick visit, okay, cough, cold, that kind of thing. But of course, you want to get to know the person and make sure that you have what you need to take care of them. Allergies, background, family history, lifestyle, socioeconomic information, all that kind of plays into healthcare. So it's important to establish.
I want to talk a little bit about hormone replacement.
Yes.
Okay, very important because a lot of people, a lot of people go online and they try and buy things even off of Amazon, right? What are your thoughts about hormone replacement today? And also, I want to say, is it for both men and women?
It can be for both men and women. I think it's important to weigh some of the different side effects and evaluate the metabolic state of the patient, depending on whether it's perimenopause, low libido, erectile dysfunction. So it all depends. Very patient-centered, very patient-specific.
Yeah, and the best thing is to make sure that you are working with somebody who is getting to know you, knows
Correct.
exactly what your needs are, both men and women for sure. I know that for a fact. And exciting that they were going to be at the Scottsdale Hilton Resort. It's going to be October 31st.
Yes.
From 10 to 3 p.m. They'd love for you to go. It's the Health and Wellness Expo. And you can also check her out on her website, which is HealthPointe, POINTEAZ.com. We're going to go to a break. We're going to come back. We're going to talk further because you know what, folks? Right now is about taking care of yourself. This is the most important thing that you need to do. I also love that she's not just telemedicine. She will also come to you. So she is mobile. Check her out. It's HealthPointe with an E, AZ.com.
All right.
Okay, we're going to keep on going in here. You don't have to, you can take that off if you want. Okay. But I like to go more narrow and deep on subjects, okay? And I think that is important with what you do. I mean, you're primary care, so it's almost anything. Who do you kind of work with more seniors or no?
Geriatrics is actually one of my soft spots. It was one of my very first jobs. So geriatrics always feels like nostalgia to me. Yeah, no pun intended.
No. But you know what? It's funny that you say that. When we say the word geriatrics, it's like, oh, wait a minute. I know that's me.
That's all right.
Yeah. With people who are, though, there's a lot of, we're dealing with a lot of changes.
Correct.
Right? And healthcare is so important. You had said earlier today that a lot of people who are seniors, they like to go to who they've already been to. They know them.
Correct.
But I wanted to tell you something. One thing that I have found with some of the doctors and some of the people that I talk to, that sometimes their doctor's not in their network anymore.
Mm.
They have to make changes, or the doctor's just not taking that, whatever, they're not working with them. They're moved, and they don't even really tell them. That's another thing that I'm finding out.
Yes.
Very difficult.
Yes.
What are your thoughts about all of that?
I think that's absolutely true. A lot of doctors, believe it or not, we're heading into an area where a lot of doctors are retiring. The face of healthcare is changing. There's starting to be a lot more mid-levels, PAs, nurse practitioners, acute care NPs, mental health nurse practitioners instead of actual psychiatrists that carry an MD. So because of that shift, that really plays a big role into how older patients handle their health care. I mean, if you've been seeing such and such for 30 years, they see your kids, your grandkids, and then they retire. Mm-hmm. That can be a really uncomfortable situation. I've had patients be a little off-put at first when they get to know me. After they get to know me, they love me.
Oh, absolutely. I can see why.
Yeah, so it depends. It really takes time, but things are going. They're changing.
Yeah, they are. Well, that's really kind of strange that they are, because we're not used to it.
Yeah, the boomers, just our entire, timeline. The millennials, they're doing something a little bit different. Not, kids, not as many babies are being born. I mean, everything is changing, and I think it's important that we try to meet the patient where they are and ensure that we provide, again, access to healthcare, at least options. They should be able to read a little bit about, okay, this person, do they take my insurance? Who wants to waste time?
Right, I totally agree with you.
Yeah.
So welcome back, everyone. Right now we're talking with Crystal Alston, and she's the owner of HealthPointe. We've been talking a little bit to Facebook land out there. You were mentioning how the world, your world,
Correct.
has changed quite a bit. And I want to talk a little bit about that because, I know we had mentioned about how a lot of seniors will kind of, they like to stick, but you can't stick as much all the time now.
Mm-hmm.
So you said that the healthcare arena is changing.
It is. We're seeing a little bit of shift in the graduating parties. Nobody's really, I don't want to say nobody, let me correct that. but there aren't as many enrollees as far as doctors going into primary care. A lot of doctors, they choose a specialty: cardiology, endocrinology, rheumatology, this specialized, healthcare area. But as a PCP, that's such an important position. You are really the quarterback for all the specialists. When you get to geriatrics, we're talking about complex patients. A patient who sees a cardiologist, they've had an open heart surgery. A patient who is a diabetic and has to see ophthalmology and podiatry. A patient who has mental health conditions because they are going through a divorce, they're going through grief because their loved one is, their spouse has passed away. I mean, it gets complicated. I see patients who have anywhere from 4 to 6 specialists, and I have to be the one to say, okay, are we ready for surgery? let me check with all the other specialties and make sure my patient is good to go. It takes a different set of eyes. So I think that we should be open to those changes. It takes a little working on the older population, but as long as you're patient, you listen to them. Mm-hmm. Listening is so important, being able to receive them and be received well, understanding the generation that you're working with.
So let's talk about telemedicine.
Yes.
Okay, because the people are going to say, okay, well, I want to get to know you too, and it's a little bit different, even though I know they know it. Though this is it, you don't come into an office with you.
Correct.
You do it over the phone. Which, by the way, I had an appointment this morning, and it happened to be that they did a telemedicine.
Okay.
Guess what? It was pretty cool. I didn't have to go anywhere, right?
Convenient.
It really was, and I want people to understand how it works, because you can literally get to know them and work on them very easily over the phone.
Yes,
it's amazing.
Absolutely, it can be really, really convenient. Telehealth medicine is, we really owe it to COVID. We really owe the thanks to COVID that
is true.
I'm telling you, give it up for COVID, making healthcare accessible, allowing people to work from home, things like that. Mm-hmm. It has its place. Now, with my older population, this is where I think that we should meet them a little bit more. Sometimes they're not as tech savvy. This is the disadvantage. Mm-hmm. We can't ignore some of the pros and the cons. I try to be very fair with that. They're not as tech savvy. Their kids are away. The grandparents, Arizona's a retirement state, so sometimes there aren't people to always help grandma, grandpa, auntie, uncles, let me help you log on. There's lots of questions and there's a lot of tech stuff. This is where the home visits come in, to make sure that you're there checking on all the things. Let's take a look at your medications. Let's do an EKG. So while telehealth is great for some populations, for other populations, it may pose a barrier.
I like that you said that, because
gotta be honest.
Very, very important I like that you're mobile.
Correct.
That you come to them. That makes it so nice. How many people, do you find that are immobile today?
There's, I would say, a good bit of the patients that I do see, even for my regular 9 to 5, have difficulty with mobility. They're no longer driving. They can't see that well. They're heat intolerant. We live somewhere where it is 120 degrees any given day. Mm-hmm. Eek! But it's important. We can't, it has an impact on healthcare and access to it.
Absolutely.
Are you going to wait at the bus stop or catch an Uber or a ride share? Again, technology kind of comes in there. So I think it's important to highlight that and make sure that we have alternate methods of healthcare.
So what would you do? What kind of advice would you give to somebody who hasn't been in healthcare, to their provider in a long time?
Just come in, rip the Band-Aid off, make the appointment, get out there. Preventive healthcare is so important. Routine screenings for colon, breast, those types of things. I can't say how important it is to complete.
Absolutely.
Just rip the Band-Aid off, come in.
And she does take most insurances, and she's very excited right now that she just got Medicare, so she's able to take Medicare. That is so important. You can call her at 623-286-1674. It's HealthPointe with an E. az.com, rated with the Better Business Bureau. I think, I've met a lot of people, and of all the people that I've met, I do feel that you are the most sweetest, the most excited,
thank you so much, Kara.
One of the most excited healthcare nurses, if I could say it that way,
absolutely,
right, that I've ever met.
Yes.
You know, I mean, you're really very, very passionate about what you do.
100%. 100% of my passion for healthcare comes from nursing. I owe my life to it. It's all that I've known. I've never really had a different kind of job. I've been a nurse since I was 19 years old.
It's amazing.
And it is my passion. I think that correctional healthcare taught me the most, if I'm honest, working in that arena with little to nothing, not a whole lot of access to mid-levels providers or doctors, and having to make autonomous decisions in a very serious capacity, in a very serious environment, teaches you better than any book can.
Absolutely.
100%. I actually, shout out to my family, Dennis, my cousin. I love you so much. Correctional healthcare is near and dear to me. I still carry some of that with me even to this day. You never know who you are until you can take care of somebody who can't leave you a review. They can't. There's nothing after that.
Right.
Yeah.
You know, but here's the thing. It's healthcare today, especially, is that a lot of people, they're not doing anything. They're living with what they have. Their pain. You know, they whatever it is, their issues. I've seen it. I've seen a lot of my ex-mother-in-law,
Yes.
you know, and didn't go to the doctor.
Mm-hmm.
Okay, how it's so important. Let's talk a little bit about that.
It's important. It's important to find a good fit. Don't give up. I always tell people, even when you find a PCP or a psychiatrist, psychologist, it's almost like Cinderella with the glass slipper. Has to be a good fit. Has to be a good fit. Don't stop after one bad interaction. I've had my fair share of negative interactions in the healthcare space. Being a healthcare worker for myself, for my children, I've had some experiences. It does not change the fact that you still need to be seen about. Give it another try. You know, read a little bit about your provider. Do a little bit of research to see if you can find somebody who understands you and you understand them. It should be shared decision making between a patient and provider.
The most important thing I think that everybody wants is for you to listen.
Correct.
And I think you said that.
Correct.
You know,
Huge piece.
It is a huge piece.
It is.
And one thing I could say, probably most seniors would agree with me, that the old stuff, you know, they did not take their time. Most of them didn't. Maybe years and years and years ago, but then it got to the point where you'd get in there and, you know, there would be 10 minutes for you or 5 minutes at the most.
I hate to say this, but I have to speak for my fellow healthcare workers as well. The insurance companies, you know, they pound you. 20 minutes. 20 minutes is all you get to address 99 million concerns. You want to be passionate. You want to make sure that you're clock watching, but you can't clock watch when you're dealing with people. These are people here.
Yeah.
You can't squeeze somebody's whole, chronic health history into 18 minutes. God forbid the patient doesn't get there on time. It's important to listen.
Telemedicine, she can just do it right over the phone, or she's mobile. She will come to you. You could check her out on her website. It's HealthPointe with an EAZ.com. Her phone number is 623-286-1674. All of the different types of, a plethora of different areas that you work in, right?
Right.
Okay, and what would be the most important or exciting part of what you do?
Never know what I'm gonna get for the day. Just, I guess, the unknown, praying to be receiving people well, to be received well, and just knowing that I have to do my best to help my patients the best that I can.
With all of the different medications that you see on television and this and that, do you think that people today, with everything that is just so pounded at them, what would you recommend for us to do? I'm the senior, tell me.
I would say lifestyle modifications every day of the week are going to be extra pharmaceutical every day of the week. Eat well, eat whole foods, avoid processed, don't go through the drive-through, go for a run, get plenty of sunshine, and pray.
You can't beat that. And you know something? Here's the thing, is that you are the new school, you're the new way.
Correct.
Okay, this is the way it is. Folks, you got to jump on the bandwagon with all of this, because you can't just stay in, and if you're not healthy, please call her, because that's what she implores the most. Get yourself taken care of. Whether it's through telehealth or mobile, she will come to you. Her phone number is 623-286-1674. Check it out on her website. It is HealthPointe with an EAZ.com.